Hey, it's Dr. Winters, and let's talk about why we ask about scars on our history form and what we can do about that and the problems that they cause. So, from my perspective, scars cause at least three problems. One is a tissue pull problem. If I have a scar in my abdomen here, for example, it can inhibit through tissue pull how high I can raise my shoulder. When we free up the internal dynamics of that scar, then it may help us with movement. Secondly, when we have a scar, the acupuncture type energy that's moving throughout our body can get blocked or turned, and then an organ or tissue may not get the entire energy that it needs through the acupuncture meridians or through the internal matrix of the body. Third, a scar, as we move and bend, can feed abnormal information up to the brain, just as every joint and every tissue feeds information to the brain as you move it. A scar that's unresolved, and by unresolved I mean that the internal fibers aren't aligned and they're blocking energy and they're restricting tissue. And so what we do is free that up and balance it out. So when we do that, then the scar doesn't feed abnormal information to the brain. And the brain, in a lot of ways, works on a garbage in, garbage out principle. So if we're feeding bad information into the brain's going to get bad information to control movement and to control other functions in the body. So healing is enhanced when we clear out these scars. And so how do we clear out these scars? Well, we clear out the scars several ways. Oftentimes we can use laser light, and I have other lasers that are more stronger than this one, but this one's close to me here now. And so we could use laser while we put our fingers on the scar and let everything rework. And it won't change the appearance of the scar on the outside, but it changes on the inside from the fibers being like this to being more aligned, which is a healthier situation. We could use pulsed electromagnetic therapy on the scar, which uses magnetic pulses to get tissues recharged and get nutrients in and toxins out. Another thing we can do is we have detox packs that we can place on the scar, and it kind of detoxifies around the scar. We can use wheat germ oil on the scar, for example, helps soften it up. And another thing that we can do is quantum neural reset therapy, where we put the light on the scar, get the information from the scar to the brain, and then we go through our quantum neural reset therapy process, which resets the brain, and that'll change any abnormal information going from the scar to the brain. So there's lots of ways that we can deal with that, and it's often different for each person that we see. But that's why we ask about scars on our history form and why people get better results when we clear up these scars. And so some tattoos can act like a scar and some don't. Some surgeries, most surgeries will be a problematic scar unless it's resolved, but sometimes they heal okay. But we can just look for a change in the nervous system by testing a strong muscle, placing it on the scar, torquing the tissue a little bit, and if we get a change in that muscle, we know that there's bad information coming from that scar. And so then we need to use one of those techniques I've mentioned to clear that up and clean that up. And in doing so, you can be healthier and happier. And so that's one of the reasons that we ask about scars and that we address scars in our care plan. I'm Dr. Michael Winters, Winters Wellness, Chiropractic Redefined.